Okay, Stace.
Hello, everyone, and welcome to our medical billing and coding. I'm just going to call it program meeting since like
There we go.
everybody's here, all the classes. So welcome and thank you, of course, as always. Thank you for your time and being here with us today. And I think Miss Marcia has a quick announcement before we jump into our presentation.
Well, it's more of an encouragement rather than announcement. I know that we are going through this ICD-10 manual really, really fast, right? I want to encourage you to pour into yourself. And what does that mean? That means if you're having a hard time, if you need more practice, get on YouTube, look up some YouTube videos. Really, we can explain it a million times in a million different ways, but the best advice to give you is practice, practice, practice. The more you know your manual, the better you're going to get at this. And I want you to understand, you don't have to be an expert. You just have to know the process, okay? So even though Misty didn't love cardiology with CPT, that's okay, because you don't have to be an expert. We just need you to understand the process. And I know I'm speaking from my behalf and my students, don't get frustrated. It goes by fast, but there will be more practice as we move through the modules. So be patient.
I'm already getting called out.
Yeah, Misty, you're the one that told on yourself. I'm sorry. So
it's okay.
That is
okay.
a disaster of your own making right there. But anyway, I just want to encourage you guys, don't get frustrated if you're not getting it 100% right now. It does go fast, but there will be more practice, and spend time in your manuals. Okay, Miss Brandy, I'm done. Thank you.
Brandy, I have a question, announcement as well as
Sure.
reference to what Marsha was saying. And when it comes to those exams, like I know that some of the pre-made test exams might be off some. So if you notice on your exams, when I check, I do go back and update manually. So don't be afraid if you might see you have a 60 and then I go back in and you might have a 90. Some of the codes are wrong. That was from prior years. So I do go back and update those test scores. So please, when you look at that first grade, just know that I am going back in and updating it manually.
Right. And my students, y'all are used to that. Y'all know I go in and manually grade everything. So, like, they know. They walk. It's funny because they get out of there and they have like a 60. And by the time I'm done fixing everything, it's 90 or 100. So y'all are used to that. Very good. All right. Well, if we're ready to get started, we'll jump right into our presentation, guys. Let me share my screen. Okay, and what we're gonna do, folks, Miss Crystal did chapters 4 and 5 last week, so I'm gonna continue on and hit chapters 6 and 7. Some of those really important points that we want to make sure y'all have a good grasp on, and that'll prepare you for your exams. All right, so one of the big things that they talked about kind of in depth in chapter 6 were pressure ulcers. And I know if you're in Miss Marcia's
Excuse me, I have a question.
Sure.
I just started the program like 2 days ago. Am I in the right presentation?
Yes, ma'am, probably. I'm sure it's our weekly class meeting. So yeah, I'm sure you are.
Okay, because I just did my assignments for today and it was for chapter 1.
Yeah, I'm sorry, Miss Brandy. Diamond, yeah, that's because you're not expected to jump right in the middle of this coding. Your instructor probably had you start so that you could get to know like the introduction of the ICD-10, and you're more than welcome to stay. But if you feel like this is something that's going to confuse you, then you don't have to stay, but you're more than welcome to stay with us.
Okay, just wanted to make sure.
Yeah, we're just a couple chapters ahead of where you're at right now. That's all.
Okay.
Yeah. All right. So pressure ulcers. One of the things they went in depth, and I'm gonna see if I can move that so you guys can see the pictures. But pressure ulcers develop when the circulation to an area is decreased by the application of pressure to the area. Patients restricted to a bed or unable to change position often develop pressure ulcers. These are also called bed sores, guys. Y'all might more commonly hear them referred to as bed sores. People who are bed bound or in wheelchairs, quadriplegics, anybody who's laid up for a while can get a pressure ulcer or a bed sore. As the sores ulcerate, the deeper layers of tissue, such as fascia, muscle, and bone, may be affected. Pressure ulcers are graded and reported based on the depth of the ulcer and categorized in stages as illustrated in figure 6.3. And that can be found on page, I have the page number on the next slide. I think it's 149 is where I pulled these examples from, okay? And basically the way it works is the longer that the person is putting pressure on this one particular spot, the deeper it's gonna eat away at the tissue, basically. It's just gonna get deeper. And the deeper it goes, that's when you're gonna move along in your stages, okay? And you can see here, stage 1, and I don't know really if you can see it because it's got a little button over it, but it is just redness on the skin. The top layer of skin is the only thing that's affected, what they consider the epidermis, the very outer layer. And it just gets red, it starts getting aggravated, and you can see that. And it starts to get uncomfortable, okay? And that's called erythema, redness of the skin. All right, stage 2, which is your second figure there, that's partial loss of skin. And that's where the epidermis, that top layer, starts to deteriorate and your ulcer gets deeper and you start getting into the other tissues, the deeper layers of your skin tissues. All right, stage 3, full thickness loss of skin up to but not through fascia. And basically what that is, you're at stage 3, you've gone through the top layer of skin, you're completely down into what, like the fatty tissues and things like that. And when they say up to but not through the fascia, that's basically the muscle that's covering the bone. The very last bit of tissue before you hit bone is what's considered fascia. And stage 4 is full thickness loss, extensive destruction and necrosis. And this is where the ulcer can be all the way down and then even into the bone, not just to it, but it'll start to deteriorate the bone after a while as well. And once you get to stage 4 with this kind of stuff, hopefully the patient is being treated by a doctor, and you're doing wound and cleansings and things like that, and packing and bandaging, all that fun stuff. But it's important to know which stage, when you're coding, what stage this pressure ulcer is at. And that should be found in your documentation. It should let you know which stage or give you some context clues as to what you're dealing with, what you're needing to code. Okay. All right, so another thing that was talked about a good bit in chapter 6, it was talked about in 2 different chapters. Chapter 6 was in your ICD-10 manual, chapters 11 through 14, right? So in chapters 11, which was the diseases of the skin and subcutaneous tissue, starting with code L00, and then when we went to, I think it's chapter 13, which starts with M00, and that's the anthropes. See, medical terminology practice, I need some. But the use of additional code preceding L00, diseases of the skin and subcutaneous tissue, directs the coder to identify the infectious agent, B95 through B97, in addition to the code in the categories, L00 through L008, making multiple coding necessary. And it was mentioned in multiple chapters because we're dealing with infections. So anytime there's an infection, there's a cause for that infection, either an organism, a bacteria, something to that effect. So whenever you have that, you've got to identify what caused that infection. And again, the code, the ICD-10 manual will let you know that. It'll be in the instructions, in the guidelines. right? The use additional code, right? So we just got to figure out which bacteria or organism it is that we're dealing with. But again, this should all be in the documentation of your scenario or your medical record, whatever you're coding off of, okay? And they give a great example on page 151 of multiple coding in use with code M00. Staphylococcus aureus, arthritis of the right wrist joint, okay? So in your alphabetic index, they show that you're gonna look at arthritis, acute, chronic, non-pyogenic, subacute, and it gives you your range, right? So then you're gonna go to your tabular and find the one that's best fitting our scenario. So we're starting with M00, that's our top section, and then we follow our indents down, right? We figure out which one is most specific to our scenario and run with that. In this particular one, it's the M00.031, Staphylococcus arthritis right wrist. All right, and then they go on to give you the multiple coding section of that. You have to find the infection or the bacterial agent, whatever it is that you're looking for. All right, so pyogenic arthritis is also known as infectious arthritis or septic arthritis and is a serious infection of a joint that can damage both bone and cartilage and has the potential to create septic shock. M00.031, which is the code we used, reports the pyogenic arthritis, but the cause of the infection must still be reported, which in this example is Staphylococcus aureus, right? So in your index, your alphabetic index, you're going to go to infection, bacterial. You'll get to Staphylococcus, B95.8. And then aureus right below it, B95.61. Okay, so you'll go to your tabular and verify which one you need to attach. And that's going to be secondary to your M00.031 because it's the cause. All right, any questions so far? No? Okay. And again, that you can find those examples starting on page 151 in your textbook. Okay, so the last thing they talked about in chapter 6 was the genitourinary, I hate that word, genitourinary system. Okay, and that chapter 14 in the I-10 tabular, diseases of the genitourinary system, N00 through N99. This chapter contains codes reported to report diagnosis of the male genitalia, female genitalia, breast, and urinary systems. Okay, one of the most common disorders reported with codes from chapter 14 are kidney stones, located in the index under the main term calculus. And then one of the reasons I wanted to bring this up is because none of us have medical degrees to know that a kidney stone would be called calculus, right? So that's something important to remember, because whether you go to work for a general practitioner or somebody that specializes, a urologist in the urinary system, anything like that, you're gonna see kidney stones. It's a very common illness. So the word calculus, you think about it like a calcium deposit, right? That's all a kidney stone is a calcium deposit in your kidney or urinary tract or wherever it may be. So think calculus, calcium deposit, kidney stone. And they also give another great example of that on page 155. Diagnosis: flank pain with dysuria and emesis with 3 renal calculus, visible on the x-ray. In your index, you're going to go to calculus, kidney, into 0.0. In the tabular, you go check it out, make sure, because we always verify, right? We never stop at the alphabetic index. And you work it on down. Calculus of the kidney, in 2.0. Simple enough, right? But how many people know to start with calculus for a kidney, if they're looking for a kidney stone? All right. So chapter 7 was about pregnancy, childbirth, and the periperium. Weirdest word ever, periperium. All right, and just some important things to keep in mind when you're working with these particular chapters. Okay, the coding is complex because there's an extensive use of multiple coding in chapter 15. There are instructions throughout this chapter that must be read thoroughly. And I also recommend, especially if you end up going to work for an OBGYN, that you go through the guidelines really thoroughly. And remember the guidelines, the big green section at the beginning of the chapter, right? That's where we find our detailed instructions, yeah? But we know when we get to a code in there, it's going to let us know also that it has to be brought out to the 7th character and what we need to do with it. Okay. So there are a lot of multiple coding situations in pregnancy, because a lot of the times you're coding the encounter, and then if there are any complications that are coming up, you may be coding those as well. All right. Any condition that occurs during pregnancy, childbirth, or the puerperium is considered to be a complication unless the attending physician specifically documents that it neither affects the pregnancy nor is affected by the pregnancy. So if there's just some random condition that does not have anything, they got a rash, poison ivy or something, it does not affect the pregnancy and it does not affected by the pregnancy. Hopefully everything I got when I was pregnant was exacerbated because I was pregnant. It was 10 times worse. So I felt like everything was affected by the pregnancy, but it has to be, specifically identified and documented by the doctor. Okay. Chapter 15 codes are never used on a newborn's record because they are only used on the mother's record. Your chapter 15 codes are only for your mother. They are not for the newborn. The newborn codes are somewhere else. They have their own set of codes. So these are not going to apply to any newborn case. All right, and we could not talk about pregnancy and all that without talking about trimesters, because that is a big thing in OB coding. Okay, the majority of codes in chapter 15 have a final character indicating the trimester of pregnancy. The time frames for the trimesters are indicated at the beginning of the chapter. If trimester is not a component of a code, it is because the condition always occurs in a specific trimester, or the concept of trimester pregnancy is not applicable. Certain codes have characters for only certain trimesters because the condition does not occur in all trimesters, but it may occur in more than just one. Okay, so you remember, I know my class in particular, I always talk about reading all around your codes. Go back to the beginning of the chapter, see if we find any of those little purpley blue boxes, right? The ones that usually indicate initial encounter or subsequent encounter or sequela. You'll have that same little box in chapter 15, but it'll indicate trimesters. You'll have a code exactly the same really, but it indicates trimesters instead of which encounter that they are. And most of the codes in chapter 15 require that. Not all of them, but a lot of them do. It's a big sticking point with coding chapter 15. So just always remember to check your codes and see if there's those instructions that say you need to indicate which trimester that the patient is in. All right. Let's see. Any questions about that? About chapter 6 or 7? I think that was pretty quick.
Miss Brandy, I'd like to add something about pressure ulcers if y'all would like to hear it.
Absolutely. Miss Marcia does a much better job of presenting pressure. Oh, I knew she was going to critique me too.
No, I'm not critiquing anything. I just want to talk to you guys about when I was taking my class for coding, I worked in a hospital as a unit secretary. And when I tell you that nursing homes and hospitals if you have a patient that comes in, they have to inspect the patient's body before they come, when they come in and when they leave, especially a patient who is bedridden. If your patient, if you're a nurse, if you're an aide, if your patient has a bed sore, you're in trouble. It is a huge deal in the medical community to have a patient come in and be clean and okay, and then they leave the facility with a pressure ulcer, because you know what that means? It means they were not turned or cleaned correctly. So you know, if you're working as you know, if you start off your career and you maybe are more patient care, I just want to call your attention to the fact that you have to be very careful with that. And as a coder, you have to make sure you're catching those pressure ulcers, because it needs to be on the patient's history. It really does. I'll share a little story. Brandy and I had a friend that was perfectly fine. She knows who I'm talking about. She was in a car accident, and you know, she's basically paralyzed from the neck down, and she had some huge pressure ulcers. And when I tell you guys, it is not good. She had to have the wound vac done, and I think she still struggles. She still struggles, doesn't she, Brandy? Because that does not always heal. Once they get down to the bone, once they get down to stage 4, the level 4, it's really difficult for those to stay healed for a long period of time. But that was it. I just wanted to call attention to, as a coder and as a medical personnel, pressure ulcers are very, very important.
Yes. Yeah. Thank you, Miss Marcia. No, Marcia's exactly right, guys. Once a patient gets one, it is hard, especially if they're like our friend who is a quadriplegic now. She's from the neck down, and she's our age. It's kind of scary. We left work on Friday talking about planning somebody's birthday party for Monday, and her accident happened over the weekend, and her life changed forever. And she had one particular bed sore when she came home from rehab that she had for more than a year. And she would have to make weekly trips by ambulance out of 2 hours out of town to get it cleaned and rebandaged and things. So yeah, they're a big deal. They're a big deal. And she required, you know, they require turning, like Marcia said, every 2 hours to keep them, you know, the pressure from exacerbating that skin.
Brady, if I could add something really quickly.
Yes, ma'am.
Hi, everyone. I'm Miss Danielle, one of the instructors. I'm sorry I was a little bit tardy. I was on the line with another student, but I wanted to kind of just remind you guys, the information that you're going through in this textbook is an overwhelming amount of information. And I want to remind you to stay on task and remember, we're not doctors, we're not nurses, we're not even coders, we're billers. So remember, the only thing that you need to do is remember the process of billing. Your process of billing is going to be your job. Now, are we teaching you how to code and all of that while you're in this class? We are. But you are not going to be doing this in your actual field of study. You are going to be billing. Medical billing is a procedure and a process. And as long as you can understand and know that the information that we're going through while you're in this course is information you'll need while you're here, don't try to retain it. Don't try to let it overwhelm you. Take it as it is. And take away from it what you really need, which is the steps to actually find a code in the event that you need to. Okay.
Excellent.
That
I think Miss Danielle just reiterated the exact thing that I said before we started. Miss Tardy
Yeah.
for the party. Whenever
Yeah,
she
I think
said
she
sorry,
did.
sorry, I was tardy, and I thought, don't be tardy for the party.
when you repeated exactly what I said, then y'all know that it's true. It is very
Almost verbatim.
true. It is
So it's
very
fairly
true.
close. It's
Yes,
fairly close.
the information that you're seeing in this book, it is overwhelming. It is sometimes even a bit boring. I will say that for you.
Mhm.
But again, we just got to get through.
It's like I tell my students all the time. It's not memorizing anything that's found in these manuals. It's just knowing where to find the information when you need it. That's the big thing. And that's, you'll hear Miss Marcia, Miss Danielle, Miss Crystal, we all say the same thing. It's all about the repetition And the more you're in these manuals and the more you're looking for these codes, the more you're going to retain anyway. In the process, I think I had one of my new students who just yesterday at our coding class was like, all right, the more I do this, the more it's making sense. That's it right there. Trust the process, learn the process, and you will be just fine.
It's pretty much just repetitive with everything that we learn.
Yeah. And you know, things change slightly in different body systems. You'll have different guidelines, but that's why they're there, you know, because there's no human being could possibly remember all the nuances of what to add with what and what goes first and what you have to add on. So it's all there.
If one human being can remember all of that information, I will give them a gold medal.
No doubt. If one human being could do that, they don't need to be in billing and coding.
Yeah.
So yeah. So you'll hear us all say the same things. I'll say the same things, y'all. But any questions about chapter 6 and 7 while we're wrapping that up? Any questions about anything in general that y'all have? Any questions, concerns, anything?
So I have a question, Ms. Danielle, about our test. There's dermatitis due to poison ivy.
Mm-hmm.
And I would like that explained because 25.5, find it. Says unspecified contact dermatitis due to plants except food. But the correct code says allergic contact dermatitis due to plants except food. Please explain that, because all it says is dermatitis due to poison ivy, and I'm confused to why it's not.
So on your test, one of the questions was dermatitis due to poison ivy.
Yes.
Okay, Marsha's shaking her head. Marsha, go ahead.
Well, first of all, my class went over this yesterday. So anybody that was in my class yesterday, would you like to talk about this? Come on, unmute. Let's go, Stacy. Who else was there? Is Abigail here? Who else was in class yesterday? Oh, Stacy's too. Look, she's looking in her manual. Okay, so it is plant without food because it doesn't have anything that was ingested. You came in contact with it. Matter of fact, we were laughing yesterday because I was looking everywhere for dermatitis due to poison ivy and I couldn't find it anywhere. I was like, oh my goodness, there's no poison ivy in here. Well, because poison ivy is a plant. Sometimes we can't we have to kind of go out of the box a little bit and think about what we're actually looking for. But if you would have maybe put poison ivy in your mouth, or if you were allergic to something plant-based and you put it in your mouth, that's with the food, right, Danielle? If it's something ingested, it would be considered food, correct? Help me, girl. You know, the other day I had to call you because I wasn't looking close enough.
Well, both codes say due to plants except food. But one says unspecified contact and one says allergic contact.
Okay, well, the correct answer is allergic contact, right?
Yeah. Yes.
So it's because you're allergic to poison ivy. So it is specified. It's an allergic reaction to the poison ivy, which is plant-based.
But without a record, you can't tell if it was, because it just says dermatitis due to poison ivy.
Okay, give me the code, Michelle. What's the code?
That's what everybody.
The correct one. Yeah, the correct one is L23.7.
Mm-hmm.
And I answered it with L25.5 because it's unspecified of how they got the poison ivy.
I think I had to go back and look at that one quite a few times.
L23.7, allergic contact dermatitis due to plants except food. Okay, and you chose what, Michelle?
L25.5.
L25.
Unspecified contact dermatitis due to plant.
And I would say that it would be unspecified because the coding that is given you is poison dermatitis due to poison ivy, right?
Yes. That's what's confusing me. Like, so I wasn't trying to overthink the question.
And with a lot of these questions that we come across on our test, again, you would need a chart, just like you said, Michelle, in front of you in order to grab the information that you need to eliminate other possible codes. Because if you don't have a chart in front of you, it's no way for you to say that this was due to something else, or the code that it is saying that it is. There's no way for you to actually know that, because it doesn't state that in the coding. It doesn't state that in the example in the test. I would say it was unspecified.
Well, since it was indicating poison ivy,
Dermatitis due to poison ivy. That's all it's saying, is dermatitis due to poison ivy.
I
right?
felt like that was like a loaded statement.
Well, like Ms.
The only
Danielle said, and I'm
difference-
going to reiterate, whenever you're coding for real, if this was something that was for real, you would have a whole medical record in front of you. So you would be able to make a more accurate decision.
Right.
But because they only give us little snippets, I'm impressed with the fact that you found both codes it could be. And for my class, they would get it right either code that they put in, simply because it's very close.
Yeah.
The only difference is one says unspecified and one does not, and we cannot really make an accurate determination with the scenario and the information we're given. Any other instructors want to pop in on that?
I concur.
Yeah,
No,
I
the
say,
only difference in those codes that I'm seeing is the word allergic. That's the only difference I'm seeing. But there might be some, but again, you would need the patient's chart in front of you to make that determination. So
I think that's what kind of threw me off on that code.
understandable. That's totally
Yeah.
So,
Definitely understandable.
and again, so it goes back to what we were talking about a while ago. This is not expert information. You're not, experts in any of this, but the very fact that you know where to go to find it is what's important. And your instructors are going back and looking at your codes. Like Ms. Crystal said, don't get mad if you have a 60 and you come back and you have a 90, because that's what we're looking at. We're looking at what you're coding, what you're doing, where you're getting your answers. So we are going back to look because codes aren't perfect.
Yeah, and we're also, I'm sorry, we're also
yeah, go
keeping in
ahead, Ms.
mind, we're also keeping in mind that you do not have an actual chart in front of you.
Correct.
We're keeping that in mind. You don't, and again, I say this again, you're not coding to, you're gonna need to know where to locate your codes, but you're not coding to actually code. When you start in the field of study, you're not gonna be coding scenarios. So as long as you know the processes of finding, alphabetic index, tabular, confirmation. As long as you know the processes of getting to those things that you need to get to for your NCCT test, you're doing amazing, because I can say that for NCCT, the coding questions are a bit more specific. It's going to give you more information than the information that you're seeing in your test from us.
And I hope you guys understand that we're not just teaching you just to take a test, but we're having to teach you in a general way because we don't have actual medical records in front of us, medical documentation. So you're just going to have to bear with the process. And the very fact, I want you to celebrate the fact that you got one or the other code. Because if you build out either one of those codes, they probably get paid anyway. But you want to be more specific, of course. But you're not looking at necessarily a wrong and a wrong code, or a right and a right code.
That's kind of like the scenarios that they put in there. Like if you've got to go through and read through it, you can kind of skim through and see the keywords that you need. Correct?
Mm-hmm.
Yes, Misty.
That's correct.
I'm getting it.
And once you get to
slowly.
the job market, it's not going to be you having to decipher all of this information off of a medical record either. Like I tell my students, more than likely, y'all are going to get passed a super bill that is going to have the majority of what you're coding right there on it for you. And you just need to verify and bill it out, basically. That's a lot of what it is. But you've got to know when you do need to verify, or when you have something that's not every day come across your desk, you've got to be able to know where to go to find that information, where you need to go to verify what you need to verify, essentially. Good questions, though. Really good questions. Anybody else?
Miss
No?
Brandy, this is
Yes, ma'am.
Kathy. I sent you a text about the mock interviews. I don't know if you've seen it. If you could
I
get
did.
back.
I did.
Okay.
I'm waiting to hear back.
All right. Thank you so much. I was wondering.
No problem. Anybody else?
Is it 5:30 yet?
It is not. It is not, I'm sorry to say. But it is 4:37, but if you guys don't have any more questions for me, that's all I've got for y'all today. And just thank y'all for giving me your time. I appreciate it so very much. And I'm not sure which instructor has next week. You guys know?
Since it's review, I'm not sure. So we will get together. Maybe tomorrow we'll decide what we're gonna do for next week. But still will be at 4 o'clock. We're not changing times on y'all. I know I can't flip flop like that. So
No. Same time, same bat time, same bat channel.
there you go.
Same craziness.
Okay, one quick question. And it's on the blackout. And I just want to make sure I'm clear on, isn't that going to be next week or something like that?
Yes, it's supposed to be
Okay.
next Thursday and Friday.
All right.
What's going on?
My class who thinks blackout is today and tomorrow completely ignore what Miss Brandy said. Because they gave us one date, then they changed the dates again, and they changed the dates again, and we don't go backwards. So
Right.
we're saying Google Class.
Ryan knows, right? I instructed my class yesterday that we're still going forward with Google Classroom, like was the plan. So, and I think everybody has planned to do the same. We're just moving forward. They just adjusted their dates, but we're moving forward like we said we were moving. So,
I do have a question for Miss Crystal.
Yes.
Okay, so the Google Classroom assignment that you put on there, can we do that on our laptops or do we have to do it on our phones?
you can do
You
it
can do
either,
Yeah, either one.
whichever you prefer.
Yes.
However, you can open Google, you can probably do it that way, I would think.
Phone or laptop.
I think I'd be better off doing it on the laptop because if I try to do it on the phone, I would be confused.
Yeah.
Yeah,
I
do
don't-
what's best for you.
I have issues with documents on my phone. I can't ever find them again. So I tend to do my stuff on my computer. But, you know,
Hence the reason I'm a natural blonde.
some of you younger ones are more tech savvy than us. So y'all do your thing.
Look, as long as you submit your assignment.
That's it. That's it. All right. Awesome. Anybody else? Great questions, guys. Anybody else? No? All right. Well, then we will cut you loose for today. Y'all have a great weekend and stay safe and happy and healthy.
Bye, everybody.
Bye, guys.
Bye.